and expanded, causing obstruction to breathing. And when breathing, that would be a hissing noise. So we urge parents that with COVID, there may be trachea and throat inflammation with the children. So if you have noticed difficulties of breath or abnormal chest or abnormal sounds when breathing, like that, like barking noises, you should send the child to an A&E for treatment. Starting last week, infants aged 6 months old to 3 are eligible for vaccination. With vaccination, the risk of severe illness and death would be significantly reduced. So if your child is eligible, please do not hesitate to get the child vaccinated. There are 7 new deaths, including 4 males and 3 females, aged between 66 and 88. Among them, 4 were not fully vaccinated. 2 of them didn't even have 1 dose of vaccination. So not fully vaccinated patients, especially totally unvaccinated patients, have much higher risk of severe conditions and even death. So once again, I call out to the public, if you are not vaccinated or if you have only received 2 doses and it is time for you to get the 3rd dose, do so quickly. That will significantly reduce the risk of severe illness and death. Now, the other 3 deceased patients received 3 doses. According to the record, a 68-year-old male was sent to hospital because of an accident on the 6th of August. And then checking his record on the 20th of July, he was tested positive for COVID. So under the 28 days rule, he was also counted as a death with COVID, but his death is not related to COVID. Another deceased patient on the 31st of July, the patient tested positive for COVID via RAT. The patient did not seek medical assistance until the 6th of August. The patient was presented with symptoms on the 31st and was tested positive. The patient did not seek medical assistance until the 6th. On the 7th, in the small hours, the patient's family members found the patient to be unconscious. An ambulance was called. Resuscitation was given. The patient was rushed to the Netherso Hospital's A&E D and was declared death. Was declared dead in the A&E D. Now, his body is sent to public mortuary for investigation. Another deceased patient, an 80-year-old male with multiple illnesses, including hypertension, high blood fat, and low platelet count. And he also has lung issues. He needs oxygen support. He was 80 years old. He was admitted to the hospital on the 3rd of August. Situation turned for the worse, and he passed away yesterday. So all in all, for the unvaccinated, the death rate is much higher. Members of the public should seize the opportunity to get vaccinated. 136 patients recovered yesterday, including 121 patients discharged. Also, one patient was found to be positive via admission screening test. 12 patients in the same wards, and staff were close contacts. 26,578 HA staff members have come down with COVID. 26,017 have returned to work. The newly infected staff members include the chief executive, Dr. Wat Wing Kwan, at the Caritas Medical Health Center. She last worked on Thursday. She followed all the relevant requirements and wore a mask. She did not come into contact with patients, and she did not travel. The CMC has performed thorough cleansing for her office and also tested all patients and staff members, and they are all negative.
Good morning. We have, as at yesterday, 3,807 new cases, PCR cases 1,428, and RAT 2,379 cases, 233 imported cases, 206 through PCR, and 27 through RAT. As Mr. Lau has, Dr. Lau has mentioned, we have reported 7 death cases. So in the 5th epidemic, the total number of the mortality cases are 9,334 cases. Of the 233 imported cases, 103 were discovered at the airport, 98 at the quarantine hotels, and 32 were discovered after the relevant patient had left their hotels. They came from 49 places. There were 6 places with more than 10 cases. UK 45, US 27, India 18, and Canada 12. And then there are another 33 from places with fewer than 10 cases each. For the homes, care homes, we have 8 RCHE and 3 RCDE have reported cases. The first one is a Long Hang, the Salvation Army home. There's a 1 resident confirmed, and another relevant, resident there have to be quarantined. Another in the Northern District, Buddhist RCHE, one case was reported. 11 residents have to be quarantined, and another in Sumshui Po, 1 resident was confirmed. Another 5 have to be quarantined, and the Christian Yan Yi Koi home, and 1 case was reported. 2 residents had to be quarantined, and another Chong Yat Yun in Wong Tai Sin, a daycare center for the elderly. The 2 staff members were reported, and 4 co-workers and 3 residents have to be quarantined. And Bradbury care homes in the Southern District, 1 staff was confirmed. 2 residents have to be quarantined. Another in Wong Tai Sin Kwong Tai, 1 case was reported. 7 residents have to be quarantined. And in Tuen Mun Chong Ming home, 2 residents were confirmed. 10 other residents have to be quarantined. And the Sun Tin hostel, RCHD, 1 case was reported. 4 residents had to be quarantined. And TWGH, Yulin Sun Daycare Center and hostel, 1 staff was confirmed. The 3 residents have to be quarantined. Another Kong Chi in Fan Nang, Northern District, 1 staff member was confirmed, and then 1 resident has to be quarantined. For schools, 402 schools today reported 692 cases, 541 students, and 151 teaching staff. The 692 cases, among the 692, 126 were confirmed this morning, 177 Sunday, 178 Saturday, and 211 were confirmed prior to last Saturday. They come from 90 kindergartens, 183 primary schools, 117 mid-secondary schools, and 12 special schools. For the past 7 days, 255 schools reported more than 2 cases, and we have recommended that for some classes in 11 schools, they would have to be suspended for 1 week. And with this will include the Lutheran School, Wong San Chok Ying Memorial School, class 5A, 25 students, 3 cases were reported. Hong Chi Chim Mun School, a special school, 1 student was confirmed, and 52 S23 class, there are 10 students. All of them have to suspended for 1 week, 2 weeks. 5B, professional spot, 29 students, 3 confirmed. Salvation Army, 40 students and 3 confirmed. And for the Celsian school, 4 students among 34 were confirmed, and they took number 3 school bus, including those who took number 4, 45 of them. 2 students were in class 2A. There are 16 students. Apart from these 2, that there are other students who did not take the school bus have been confirmed. So therefore, school buses number 3, number 4, all these students will have to be suspended for 1 week, and also for class 2A, it will be suspended for 1 week. As for Cheung Chuk San, class 3B with 3 confirmed cases among 28 students. And the Baptist Chanlei K2B, 3 students and 1 teacher have been confirmed among 27 students. And in Yunnan, class N1, 12 students, 2 cases were reported. The Methodist Church, Oiwa, Chin, kindergarten, K3B, 16 students, 2 cases were reported. Siu Hon Sam in Sha Tin or Pulangkok, 32 students and 4 confirmed cases have been reported in class 4B. And in Sai Kung, Jiangjikji Secondary School, class 5C, 22 students, 4 confirmed, and all these will have to be suspended for 1 week. For the various variant, we have BA4, BA5 cases on the rise. Some preliminary figures tell us that they account for 12.7% of the total, outdoing the BA2 from 12.1, and which stood at 6.3%. But of course, most cases are BA2.2 variant. We now have a Q&A session. Please tell us the organization you represent before you put your question. I'm from Hong Kong 01. I have a question about the 3+4 quarantine arrangement. And it's been suggested that if those who have a yellow late mark, they can go to school or work. They will not be barred from medical institutions and clinics. So what is the public health rationale of doing this if they are barred from prescribed premises only? And of course, individual occupiers of premises can set their own rules. So are you shifting your responsibility to them? And today, Professor Low said the 3 days of quarantine in a hotel will be sufficient. And in the past, it was suggested that they will not be able to take public transport. So the yellow icon, yellow code, is it really meaningful? I think they will be allowed to go to work or to school because they will be wearing masks. But they are not allowed to go to a bar or restaurant for dine-in, for example, because they will be taking off their masks when doing so. The lady on the left. I'm from Orange News. With regard to the 20-month-old baby girl case, did the family member report her case? And what's the channel of infection? Did her family members been confirmed with infection? And also with this COPE case, and also and with regard to the other mortality case, the patient went to a clinic on the 6th of August. Was it a designated clinic? And I have a question about the case of a quarantined new arrival on the 4th day. Can they leave Hong Kong if they are on transit? And when can we expect to have a full arrangement for home quarantine only? And now BA4, BA5 has accounted for 12.7% of the total. Some experts are saying that in 4 to 5 weeks, this will be the prevalent variant. As for those who have already BA.2 variant, what's the risk of infection with BA.5 now?
係話佢喺
So you mentioned the medical surveillance period, whether someone can leave Hong Kong. Well, I'm not very clear about the details yet. It depends on the destination the traveler is trying to go to. If there are requirements as the destination place, then he may not be able to meet them. Concerning the rising trend of BA.5, it is in line with the WHO and other places experience. We can't rule out the subvariants becoming the prevailing variants. There are also experts who said that BA.2 may offer cross-infection protection against the BA.4 or 0.5, but we don't have any experience yet. We need to continue observing. However, if you are fully vaccinated or if you have been infected before, then there may be cross-immunity against severe conditions and mortality. In terms of the transmissibility, whether cross-immunity can prevent infection, well, that's an unknown. Concerning the 20-month-old baby girl situation, according to record, her family members were tested positive on RAT. The infant girl was tested positive on the 5th. She had she had fever and coughing with phlegm. On the 6th, her voice became hoarse and she had difficulty breathing. In the early hours of the 7th, her mother took her to the A&ED. Her body temperature was 39 degrees Celsius, and she had a hissing noise when breathing, and her voice was coarse and hoarse, so she was admitted to the pediatric ICU. Upon medication, her situation turned stable. She was prescribed with oral viral medicine because her CT value was low. Yesterday and today, her situation further stabilized, and she has been transferred to the general ward of the pediatric department for treatment. So I'm trying to tell the public that upper respiratory viral infection can cause CROP. COVID is also a kind of upper respiratory virus. By CROP, it means a laryngeal tracheal. So the bronchitis would be expanded upon the inflammation. So a high-pitched noise would be caused. And if the situation turned worse, the baby or the child would have difficulty breathing. So you shouldn't wait until the situation turns worse before taking the child to A&ED. So when the bronchitis has contracted and the child is breathing with difficulty, well, you can see that the ribs of the child would be contracted as well. So you shouldn't wait before taking the child to A&ED. It is a possible complication from COVID. So with more children infected with COVID, we have seen more cases of CROP. With earlier treatments and earlier medication, the situation can be put under control. Take, for example, the 20-month-old baby girl. After 2 days in ICU with medical treatment, she has been transferred out of the ICU. So it serves as a warning for parents. If your children develop a CROP, you should approach a doctor as soon as possible. Concerning the 66-year-old deceased female at the A&ED, so she tested positive by RAT on the 31st. She didn't seek medical assistance until the 6th of August. That is 6 or 7 days afterwards at a designated clinic. She had a fever and phlegm. The lungs sound was clear, and there was likely no inflammation or pneumonia, so she was given medication. However, later on, she was found unconscious and was declared dead as the A&ED. So the situation turned worse very quickly. It is very rare for COVID patients to have deteriorate so quickly. So we need an autopsy to determine the cause of death. So this is a 66-year-old female patient. So let me check if she had any chronic diseases. She had none, but she was about 60 years of age. So we encourage COVID patients above 60 years of age. You should see a doctor earlier, maybe within 5 days after infection for oral viral medication. Whether you have been vaccinated, if you are above 60 years old and you come down with COVID, we would give you oral drugs to alleviate the symptoms. I'm not sure whether this patient died of COVID, but I'm just trying to remind members of the public, if you are above 60 years old and if you are a chronic patient, if you are high risk, you should see a doctor as soon as possible within 5 days after infection. and get oral drugs to prevent severe symptoms and hospitalization. You can book an appointment with the designated clinic, or you can use HA Go, the mobile app, and you can also opt for video consultation via by video. It is more convenient, and the medication will be delivered to your door so that you can get the medication promptly. Next question, the lady over there. Hi, I'm from Now TV. Concerning the new cases today.
因為嗰3個確診嘅學生都坐過個
Now, the Salesians College, there are 2 school buses. So is it because of the school bus, the school bus that caused the infection? Now, the Jockey Club said that the staff members were involved in a private gathering. So how many people, how many patients are involved, and how many close contacts were there? What kind of high-risk activities were they involved in? Now, teachers and students issued with a yellow code can still go back to school. So does the CHP think it will pose a risk to schools? What kind of advice would you give the schools? Now, for HA staff issued with a yellow code, will they still be allowed to go back to work? And would they be assigned back office or support task without contact with the public?
校巴咧就係
The school buses, well, there were 4 students taking number 4 and number 3, and 2 students attended class 2A. We don't know the channel of communication, but they could, for all those who are at risk, we would advise them they stay away for a week from the school. As for the new arrivals from other countries, they will have to do RIT on the first day, and then the 2nd, 4th, 6th, and 9th day for RIT test as well. The first day is PCR, and then they would have to get a negative report before they can go back to school. That would reduce the risk. As for the arrangement for people with yellow code, well, the CE only announced the arrangement this morning. Now that we know that the new arrangement will be in place, we would work out the arrangement for our staff accordingly. According to the press release, it's permissible for them to go to work or to school if you have a yellow code. But HA is the employer of our staff. We'll pay attention to the circumstances to make suitable arrangements for our staff. But this speakers of mine, it will be very quick. We'll come up with something in a few days' time.
Okay. So what's the trend of serious illnesses found in young children, and is it in line with the overall trend? And is the proportion of young children having serious illnesses after an infection similar to that of the adults? Thank you.
As reported by the pediatricians, there are increasing number of children with the syndrome called COP, which is a laryngotracheal bronchitis. This is an inflammation of the larynx, trachea, and the bronchus due to the virus. In this case, is because of the COVID-19 virus. When the patient gets the infections of the airway will swell, blockage the airflow, which can be a life-threatening situation. And the pediatrician want to appeal to the public, especially for the parents, that if you find your child who has suffered from viral infection, for example, COVID-19 infection, and show difficulty in breathing, increasing breathing rate, and also some sucking of the intercostal spaces, and also maybe some hoarseness of the voices, and some what we call stridor is some high pitched sound during the breathing. Please bring the child to see the doctor, as well as to go to the emergency department as soon as possible, because the child may need some urgent treatment which can save the life of the child. The trend is they report that there are increasing number of quote in past few weeks because of the COVID. Yeah. Sorry. Oh, okay. I don't know whether there's under other serious illnesses, but there are reported cases of increasing some multi-organ inflammation system inflammation after the COVID. What we can do is how to prevent the COVID, or how to make the illness become less serious, less severe, is by vaccination. Pediatrician confirms that the child with vaccination or completed the vaccination has less serious condition. So I want to appeal to the public, please bring your child to have the vaccination as soon as possible, especially for the young child, 6 months to 3 years old, which has the vaccination has been started last week. We want more child to have vaccination, that they may have less chance to get a serious condition.
下一題啊，右手邊前排近
The lady in the middle. I'm from cable TV. You mentioned the crop, and if there are characteristics, and if the patient are sent to the hospital very quickly, do they stand a good chance of recovery? And some doctors have said that the protection from vaccines based on BA.2 will not protect you against infection for BA.4 or 5. And then there was a person who was sent to the Penny Spade Center, although he's not infected, and he's unable to leave right now. So what should people do if they're in such a situation? And also with regard to the Jockey Cup cluster, can you tell us more about the situation now? Well, I'm not going to go into the details of any cluster. As for the vaccination, the expert advisors have not advised us to buy new vaccines. According to WHO, the current vaccines are good for protection with regard to BA.4, BA.5 variant. I don't know much about the case of a person being sent to Penny Bay, but I don't know much about the case. But I do know that some people are confused about the telephone numbers to call, because there is a number that infected patient can call, so that you can be sent to Penny Bay quickly. But you need to report to the Department of Health first. If it's RAT positive, there's a online platform that you can use. If it's a PCR positive, you have received a message with a link asking you to make a report. And if you don't use either, then the DOH will not know about your case. I know that some people would call the Fire Services Department's hotline, saying that he or she is infected, and he or she will be sent to Penny's Bay very quickly. We have been told by pediatricians that there are more crowd patients being hospitalized in recent weeks. But is it that there's a good chance of recovery if the patient is sent to hospital very quickly? Well, of course, it's always good to go for early treatment. But of course, you must not be too panicky. So we would advise that you should observe the symptoms, whether the voice is coarse, the breathing is short, and you have a barking cough syndrome. That will be symptomatic of a cough patient. Of course, there are other symptoms: upper respiratory tract infections, a fever, a running nose, etc. But if you can bring a child in such a situation to the doctor as early as possible, and of course, some medicines are only available in a hospital. Then in that case, you get early treatment, and the chance of the situation, the conditions deteriorating will be minimized. That's the speakers of mine. I don't know about the details of individual cases. If need be, please provide more details, and I will see if my colleague can help you.
Next question, please. Hi, I'm from AM 730. Now, about the three deceased patients, the 68-year-old male with an accident. So was that unrelated to his medical condition? And what about his negative results? Because you mentioned that he was tested positive 28 days ago. So the second one, 80-year-old male, when was he confirmed to be a patient? His situation turned worse upon admission, so was the situation unrelated to COVID? Now about the school buses, number 3 and number 4, how many staff and students were on each school bus? And what about the students who were on both buses? So there were 28 students or staff, and there were 2 infected students on each bus. Is that the case? Now about the hotel, how many rooms were there, and it's the time that we have to identify a new hotel for quarantine. For the Salesian College, there were 45 students on 2 buses. 52 students, 45, included 45 on number 4, and 7 students who were not on number 4. Altogether, 55 students. So altogether, there were 4 infections on both school buses. So you were right. In class 2A, there were 2 students with COVID, and also 2 other students who were not on the school buses. On the number of teaching staff on number 4 and number 5 school buses, there are no infection among teaching staff yet. Concerning malaria, we have reported 75 cases, and then there were 2 new ones. And there are also 1 or 2 suspected cases pending hematological reports. Now, there are more than 100 malaria patients sent to Cosmo Hotel, and more than 100, so I don't know about the number of rooms. Concerning the 68-year-old deceased male, on the 20th of July, he became positive. On the 6th of August, upon admission to hospital, the PCR test returned negative with no nucleic acid of COVID detected. So his admission was unrelated to COVID. So probably his death was unrelated as well. For the 80-year-old gentleman, he tested positive on RAT on the 31st. He had sought medical assistance and was prescribed with oral medication. But his shortness of breath continued. On the 3rd of August, he was admitted to hospital. Another PCR test revealed a CD value of 25, and he was given remdesivir. His situation continued to deteriorate, and he passed away yesterday. On malaria, as Dr. Zhuang mentioned, there are 77 malaria patients confirmed. As at noon today, 47 malaria patients are being treated in public hospitals, including 45 males and 2 females. Among them, 2 are in serious condition. The remaining 45 are stable. We will continue to closely monitor the patient's situation and offer them suitable treatment. Next question, please. The lady up over there. Good afternoon. I'm from Ming Pao Daily. Now, CHP for people with a yellow coat, if they go to work or to school, what about the meal arrangements? Would you give them any advice in terms of meal arrangements? After the red and yellow coat system is put in place, for positive cases discovered during the medical surveillance period, would the patients be sent to Penny's Bay or quarantine hotel, or can they isolate at home? Now, question for the HA. Yellow coat people cannot enter designated medical establishments. So what are they? Do they include public hospitals, HA or DH clinics? What about private hospitals? So do you have data or statistics on the percentage of COVID inpatients? How many of them are imported? Now, about the crop situation, you said that there have been more people sent to hospital because of crop. So how many were there, and how many of those patients ended up in ICU? So you mean upon the 3-day hotel quarantine, and then in the remaining 4 days on medical surveillance, if they go to work or school, it would be best if they eat alone. They cannot enter any catering establishments or other scheduled premises requiring a vaccine pass. As the workplace or as school, they should avoid contact with others as well. If they are confirmed with COVID during that period, they are required to report their status, and then they will follow the current triage arrangements. If their home environment is not suitable for home isolation or other reasons, they will be sent to community isolation centers. Concerning the definition for designated medical establishments, well, under the vaccine pass arrangements, some DH establishments premises are would require vaccine pass. Same for our outpatient clinic, but the DH has said that yellow coat people can see a doctor. However, for yellow coat persons who are accompanying a family member to seek medical consultation, they will not be allowed. For urgent patients, even if they are given a yellow coat, they will still be allowed in. For crop, I don't have the statistics, but the number should be very low because we would be informed by the ICU. So we know there are more cases and there are more ICU patients because of crop. With early treatment, the ICU, it would be less likely for patients to require ICU treatment. So that's why we ask the public to get vaccinated and seek medical assistance sooner. The last question, please. Hi, I'm from Hong Kong Economic Times about the students' situation. Now, in secondary school, full day school has resumed, and for fully vaccinated students, they can take off their mask for some activities. So what kind of advice would you give to yellow coat teachers and students? Now, 80% of the imported cases were discovered upon 3 to 4 days, 2 days. So what about the number of positive patients tested positive on the 3rd or the 4th day or after 7 days? How many cases are we missing? As the Secretary for Health mentioned, positive rate after 7 days is 1%. The remaining were caught during hotel quarantine. For schools, since this is a new policy, we need to consult with the EDB whether guidelines should be issued. That's the end for the press briefing. Thank you.